will be straight, but the towel will provide a little lift under the knee. From here, engage your quadriceps muscle by pressing down into the towel. Imagine you are trying to flatten out the towel underneath. As you do this, your foot might slightly lift off the bed, which is completely fine. But once you've pushed down, the key is to hold this contraction for 10 seconds, really feeling the muscle activation in your quads. After holding for 10 seconds, slowly relax your quads and get your leg back to its resting position. This exercise is called quads over row. Perform 10 repetitions on each leg 2 to 3 times a day. Now, the biggest mistake I see people making is that they push really hard and fast. This is not effective. Rather, perform each repetition slowly, building the pressure and holding before again slowly relaxing. You can make this exercise harder by lifting the leg up off the bed, ensuring your leg is still straight. Repeating 10 times. This is called a straight leg raise. It also works the quadriceps. Now, if you have moderate or severe arthritis pain, a key tip is to use a towel roll that is a little bit bigger and softer. This is a gentle way to target those same muscles, but work much better when you are recovering from a surgery or if you have limited mobility. Now, this brings us to a common concern. Is it safe to exercise a joint that's already in pain? The short answer is yes. Not only is it safe, but it is essential. A 2024 clinical guideline on knee osteoarthritis confirmed that some discomfort during exercise is normal, especially when you're just starting out. This doesn't mean you're causing damage. It's simply part of the process of getting stronger. What's amazing is that exercise is beneficial even if you have severe osteoarthritis or if you've been told you're bone on bone. When it comes to exercise and pain, think of your knee joint like honey. If honey sits out for too long without being stirred, it hardens, becoming stiff. But when you warm it up and stir it, it turns soft and smooth again. Exercise does the same thing for your joints. It keeps them fluid and flexible, which reduces that creaking and aching pain. I like to remind all of my patients these two simple truths. Number 1, motion is lotion. And number 2, rest is rust. The more you move in general within your tolerance, the better your joints will feel. Okay, enough of me talking. Let's at the back of our knees called the hamstrings. This group of muscles is essential in helping us bend our knee, which ultimately helps with things like walking and bending down without pain. So here's how to perform the glute bridge. Lie on your back with your knees bent and feet flat on the floor or bed, knees hip width apart. Place your arms at your sides, palms facing down for stability. From here, engage and tighten your core by bringing your belly button down. As you inhale, press through your heels and lift your hips off the floor, squeezing your glutes at the top. Your body doesn't have to form a straight line, just go as far as you can. Hold this position for a brief moment, ensuring your glutes, hamstrings, and core are engaged. Exhale as you slowly lower your hips back to the floor, maintaining control throughout the descent, performing 2 sets of 10 repetitions. To make this exercise easier, you can perform an exercise called a knee curl, where you are standing up, holding onto a chair or counter in front of you, and bending the knee, repeating 10 times for 3 sets. This is a much gentler way of working those same hamstring muscles. To make the glute bridge more challenging, try incorporating a single leg variation. Lifting one leg while performing the bridge adds way more intensity and engages your stabilizer muscles of your side glutes even more. So now that we've strengthened the 2 key muscles of the knee, I'll show you one exercise that strengthens the knee joint itself. Exercise number 3 is inspired by a groundbreaking study that uncovered a powerful way to reduce knee joint inflammation from arthritis. This move, called the static low angle squat, is simple but highly effective for relieving pain, improving range of motion, and strengthening your knee joints. I'll show you a gentle version to get started today. All you need is a wall. Start by leaning against a wall with your back, your feet shoulder width apart. From there, take one step forward so you are roughly 2 feet away from the wall. Making sure your shoulders, back, neck, and hips are supported by the wall, you're going to slowly slide down the wall. You can use the support from a chair nearby if needed. Continue sliding down slowly. This study suggests aiming to reach about 90 degrees of knee bending. However, I suggest you slide down as far as you feel comfortable. The key here is that once you reach the bottom point, stay there for 10 seconds and then slowly slide back up. I suggest starting with 5 repetitions of this. The beauty of this exercise is that most people can do it because you can choose the difficulty by deciding how far you want to go down. If your knees are really aggravated or if you're just starting off, start with partial wall sits, maybe 25% down. But for added challenge, you can of course go deeper or hold longer at the bottom for maybe 30 seconds for 5 sets. You can make this even harder by using a 5 or 10 pound weight in your hands. Now, if you're new to strengthening exercises, I suggest you start this one at maybe 2 to 3 times per week only, because it allows your muscles some recovery time in between. So far, we focused mainly on strengthening the muscles and the joint itself of our knees. For exercise number 4, we're going to shift to an often overlooked aspect of knee health. That is flexibility and joint lubrication. This exercise is simple and is called flexion and extension, the only 2 movements your knee can make. Start by lying down on your bed with both knees bent. From here, grab the back of one knee with your hands. You may use a towel if you are unable to reach your knee with your hands. From there, slowly bend the knee and straighten it, repeating 10 to 15 times on each knee. For added challenge, you can grab your shin or the lower leg and bring your heel closer to your bum as far as possible. Again, follow this movement by straightening the knee into extension. Now, there's no need to hold here. You're just going back and forth. This exercise works on the idea that when you're still for too long, especially in the morning after a full night, the fluid inside your knee called synovial fluid thickens, causing stiffness and creaky joints. But when you start moving, your body produces more of this fluid, which lubricates the joint and reduces pain and stiffness. That is why I highly recommend all my patients with knee pain to perform